Hi, this is Dr. Alemi with a brief introduction to how to construct multimorbidity index from the types of data that we see in electronic health records. Keep in mind that just taking the averages of diagnosis in the data is not sufficient because a condition that's rare and requires long stays will have misleading results. A more careful analysis will need to match cases with the diagnosis against controls without. Here are the data we will work with. In this example, we will assume that severity of the patient's illness is proportional to their length of stay. The first group of patients have three diagnoses: MI, congestive heart failure, and diabetes. They stay on average 5.56 days. There were 10 such patients in our medical record. Notice that the first row is more than just one patient. It's 10 patients. Note that the number of patients with different sets of diagnoses are quite different. Some combination of diagnoses occur many times, others less often. Use the if statement to create a series of binary columns where the presence of a disease is shown as 1 and the absence as 0. Calculate the length of stay for cases. Do this as the product of two columns divided by the number of combinations that have MI. Since number of cases and controls are going to be matched, we do not need to include the number of patients in this analysis. It will always be the same within the same combination of diagnoses. Calculate the number of controls, but this time use 1 minus the column. Estimate the score of each diagnosis as a difference of the length of stay of cases and controls. These scores can now be used to score the patient's prognosis. The severity score is the sum of the diagnoses that are present. Note the dollar sign so that the cell address does not change when you copy and paste it. This way you can make the score in one cell and copy to the other cells. The severity score of a patient with MI, congestive heart failure, and diabetes mellitus predicts that they will stay longer than 3 days. In fact, 5.51 days.